Okay, I'm back. Sorry, Yusek. Once again, good afternoon, everyone. Thank you po for joining this media forum for today, January 11, 2022. With us po for this afternoon's media forum, of course, our Undersecretary for Health for Public Health Services team, Yusek Maria Rosario Singh Vergere, together with the experts po from our all experts group. From the technical advisory group, we have Dr. Ana Ong Lim and Dr. Edsel Salvania. And also we have Dr. John Wong from the data analytics group. Yusek Reset for your presentation and for your message po.
Yes, thank you, Jas, and magandang hapon po sa inyong lahat. Welcome to our Tuesday's Media Forum, together with our experts from our technical advisory group and from our epidemiologist from Epimetrics, Dr. John Wong. Magandang hapon po sa inyong lahat, sa ating media partners, sa ating mga healthcare workers na nakatutok ngayon, at sa lahat po ng mga Pilipinong nakatunghay sa ating saanmang bahagi ng bansa o ng mundo. Patuloy pa rin po sa pagtaas ang bilang ng kaso sa ating bansa ngayong ikalawang linggo ng Enero. At inaasahan pa rin po natin na tataas ito dahil sa Omicron variant na highly transmissible. Kaya naman po mabilis kumakalat sa ating mga kapamilya at katrabaho ang sakit. Gayunpaman, kahit na banayad ang simptomas na nararamdaman ng marami sa atin, we assure everybody that the Department of Health continues to monitor not only the Omicron variant, but even the previously identified variants, as these are still also circulating. Narito po ang Kagawaran ng Kalusugan para sagutin ang mga katanungan at upang iparating sa ating mga kababayan na sama-sama po tayo sa laban para puksain natin hindi lamang ang Omicron variant kung hindi ang kabuuan ng COVID-19. With that, the DOH shall provide you updates on our changing COVID-19 situation. Para sa unang punto, next slide please. Para sa unang punto, sa nakalipas na linggo, ayon po sa ating mga reported cases at base na rin sa resulta ng whole genome sequencing, makikita po natin sa graph na ito that while the epidemic curve is indicative of the Omicron variant, the Delta variant pa rin po ay nagsisirculate pa rin ayon sa ating genome sequencing. Next slide please. Para naman po sa pangalawang punto, nais po naming ibalita na sa pagitan ng onset ng Delta at ng holiday surges, mataas pa rin po ang itinaas ng ating vaccination rate sa NCR kumpara sa ibang bahagi ng ating bansa. Pagbati po sa mga mamamayang nakilahok sa National Vaccination Days noong November 29 hanggang December 1 at December 15 hanggang December 22. At pagbati rin po sa ating mga healthcare workers at mga lokal na opisyal na nakatulong sa pagpapabilis ng pamamahagi at pagtuturok ng mga bakuna. Inaanyayahan po natin ang iilang hindi pa bakunado na magpabakuna na at kaagad magpa-booster ang ating mga eligible na magpa-booster para sa karagdagang proteksyon laban sa COVID-19. Para sa pangatlong punto, sa kasalukuyan, ang mga kasong naitala sa National Capital Region ay mayroong 60% less chances of hospitalization kumpara sa mga kaso sa ibang parte ng bansa. Ito ay higit na totoo sa nagdaang holiday season. Para sa pang-apat na punto, globally, nakikita ang decoupling dulot ng mataas na vaccination rates. Ang decoupling ay nangangahulugan na bagamat tumataas ang bilang ng mga kaso, hindi po ito nagta-translate sa malaking bilang ng severe at critical cases. Sa kasalukuyan, nakikita po natin itong decoupling na sitwasyon o fenomeno na ito dito po sa National Capital Region. Ikalima, nais po naming ibalita na nakakakita rin po tayo ng pagbaba ng mga severe and critical cases. Ngunit hindi po ito indication para mapanatag ang karamihan dahil tumataas naman po ang kaso ng mga mild at asymptomatic cases. Pinapaalalahanan pa rin po natin ang publiko na magdoble ingat ang lahat at patuloy na ugaliin mag-comply sa minimum public health standards upang maiwasan po natin ang transmission ng virus at ang mutation po nito. Pang-anim, Dahil sa mataas na vaccination rates sa National Capital Region, dalawang klase ng COVID-19 patients ang nakikita po nating nai-admit sa ating mga ospital. Una, ang mga admitted dahil sa COVID-19, kagaya ng mga may sample diagnosis na may COVID-19 pneumonia. Habang pangalawa, ang mga pasyenteng ina-admit para sa ibang kondisyon, ngunit incidentally, nagpo-positibo po sila sa COVID-19. Ilan sa mga halimbawa ng kasong incidental COVID-19 ay ang mga na-admit dahil sa acute appendicitis, acute coronary syndrome, CVD infarct, intracranial hemorrhage, trauma from vehicular crash na bagamat inadmit po sila sa ospital dahil sa mga nasabing kondisyon, upon admission naman, sila po ay nagpositibo sa COVID-19. Pampito, mula po sa pattern ng Delta at nung nagkaroon po tayo ng pagtaas ng kaso dahil sa holidays, makikitang iba na ang pattern ng COVID-19. Batse sa datos ng Philippine General Hospital, malaking proportion po ng mga pasyente ay incidental COVID-19 patients. Ang ibig sabihin po nito ay ang pasyente ay magpapa-admit sa ibang dahilan, ngunit upon taking the RT-PCR test in the hospital, makikita po ng ating mga healthcare worker na sila po ay positibo rin sa COVID-19. Kung makikita po natin ang graph noong September 5 to 18, 2021 na maiugnay sa Delta increase in cases, 53.9% ang admitted for COVID-19 habang 46.1% naman po ang incidental COVID-19 patients. Pero kung titignan naman po natin ang graph ng ating pagtaas ng kaso ngayong nag-holidays, na nakapaloob sa mga petsang December 25, 2021 hanggang January 7 of 2022, makikitang 88.7% ang incidental COVID-19 patients, halos doble po nung nakaraang nagkaroon tayo ng Delta situation. Pangwalo, makikita rin po natin ang same pattern sa ating mga DOH NCR hospitals. Kung titignan po natin ang table, meron po tayong 1,284 patients na na-admit sa ibang kadahilanan, ngunit na-discovering meron silang COVID-19 nung sila po ay na-admit na sa ospital. Kumpara sa mga pasyenteng nagpa-admit dahil sa nasabing virus na nasa 226 lamang po. Para naman po sa mga pasyenteng na-admit sa ICU, 50 na katao ang naitalang na-admit dahil sa COVID-19, at 67 naman ang nagpa-admit sa ibang kadahilanan, ngunit ay nag-positive din sa COVID-19. 8 naman ang pasyente ng COVID-19 na gumagamit ng mechanical ventilators at 16 ang pasyente na na-admit dahil sa ibang kadahilanan, ngunit nakita rin na positibo sila sa COVID-19. At panghuli, this graph shows the number of admitted or quarantined healthcare workers. Bagamat nakikita po natin na mild or banayad lang ang mga simptomas or asymptomatic ang mga ito, hindi po ibig sabihin na hindi po naaapektuhan o nahihirapan ng ating mga ospital. Mainam pa rin po na tayo ay mag-ingat at mahigpit na sumunod sa ating mga safety protocols upang mas maiwasan po natin ang pagkalat ng virus. Mag-isolate po at magpa-test sa unang pagkakaramdam lamang ng simptomas. I-maximize din po natin ang paggamit ng ating telemedicine consultations upang mas maiwasan po natin ang pagkapuno ng ating healthcare system or ang ating healthcare facilities. Nais din po nating ipaalala sa ating mga kababayan na mga tao pa rin po ang nagpapatakbo ng ating mga ospital. At dahil mas mabilis ang transmisyon na buhat ng Omicron variant, malaki pa rin po ang tsansang mahawa ito sa ating mga healthcare workers. Sa ganitong sitwasyon, kinakailangan din po mag-quarantine at mag-isolate ng ating mga healthcare workers. Kailangan din pong maglaan ng ating mga ospital ng mas maraming bed spaces at magserbisyo sa mga taong may malubhang kalagayan. Kailangan din pong ihiwalay ng mga ospital ang mga pasyenteng nagpo-positibo sa COVID-19 at maglaan ng mga doktor na mag-aalaga sa kanila specifically. Sikapin po natin na huwag maging kritikal ang lagay ng ating healthcare utilization sa ating bansa. Iniiksian na rin po ang isolation at quarantine period ng ating mga healthcare workers para maging sapat pa rin ang mga tao natin sa ating ospital. Bilang pagtulong, inaanyayahan po natin lahat ng ating kababayan na ugaliin po nating mag-isolate sa ating bahay kung may pamamaraan at kumonsulta po tayo sa ating telemedicine services upang kayo po ay matulungan habang kayo ay nakabukod. Para naman po sa ating mga employers, mag-impose po tayo ng work from home arrangements lalo na at patuloy po ang pagtaas ng mga kaso sa ating bansa upang maiwasan ang pagkalat ng virus sa ating mga empleyado. Next slide. And lastly, ito po ang aming mga takeaways and key messages for this week. Even most of the symptoms are just mild, cases are still rising. So let us not be complacent and continue to strictly follow the minimum public health standards. At the earliest sign of symptoms, please always remember to isolate, and isolate. We must help in preventing further virus transmission and mutation so that you and your loved ones are kept safe. Third, no test is perfect. But if we get the right test at the right time, early detection can guide the right actions in doing our part to prevent the spread of the virus. So let us not be agents of transmission. And lastly, go get the job done. Vaccines are our first line and best defense against this virus, in addition to protective health protocols. That is all. Over to you, Jazz.
Thank you so much, Yusek, for the very comprehensive explanation of our key messages for this media forum. And to start with our questions po, Yusek, so we'll be asking po the questions that has been submitted last night po. And we will start po with Caroline Bonking from CNN Philippines. Yusek, the question is, the Alliance of Health Workers said shortened isolation and quarantine period for health workers will further accelerate the spread of COVID-19. They added, this policy is illogical because the virus that infects the general public is the same virus that attacks the healthcare workers. May we please get the DOH response to this? What is the basis of shortening the quarantine isolation time for healthcare workers? Bakit po ito pinayagan? Also, Yusek, in PGH, asymptomatic but vaccinated health workers who had high-risk exposure to COVID-19 are no longer quarantined and are also asked to report immediately due to the shortage of staff. Is this safe for the other health workers and patients? Yusek.
Yes, Caroline, unang-una, no, gusto ko lang iparating sa inyong lahat, sa ating mga kababayan, sa ating mga healthcare workers, hinding-hindi po magpapatupad ang ating gobyerno ng isang polisiya na magpuput sa risk ang ating mga pasyente at ang ating mga healthcare workers. Lahat po ng pinapatupad natin ay base sa siyensya at ebidensya. Meron na pong mga ilang bansa na nagpatupad ng ganito rin pong protocol because of contingencies, because of the high transmissibility of the Omicron variant. And we wouldn't want our health systems to be overwhelmed also, and nobody's going to take care of our patients. So ginawa po ito base sa siyensya at ebidensya. Wala pong balak ang ating gobyerno na mapunta sa at risk ang ating mga pasyente at ang ating mga healthcare workers. Ito po ay ginagawa base sa risk assessment ng ating mga ospital kung kakayanin at kung ito po ay mas magiging beneficial para sa ating mga healthcare system at ang ating mga pasyente. So I will turn it over to our technical advisory group of experts, Dr. Ana Ong Lim and Dr. Edsel Salvania, to provide additional responses to this. Dr. Ana, go ahead, and then we'll have Dr. Edsel.
Thank you po, Yusek. Naging matunog talagang usapin itong shortened quarantine and isolation dahil nga actually nakita naman natin na pinapatupad na rin sa ibang mga bansa, and we have to admit that those reviews came about because of the extreme need for essential workers, hindi lang sa healthcare, pati na rin sa iba't ibang sektor. But as Yusek has mentioned, hindi naman natin i-adapt yung mga policies kung sa tingin natin walang basis or hindi tayo naniniwala or sumasang-ayon dun sa scientific evidence na kung saan pinagbasihan yung rekomendasyon. So on review, ang nakikita natin ngayon is yung characteristics ng virus that allow it to be more transmissible also come with features that allow for viral clearance to happen over a shorter period of time. So yun yung pinagmumulan ng ating shortened quarantine and isolation recommendations. Pero siguro overall, what I'd like to add is that as an additional layer of safety, kahit pinaiksi natin yung durations, meron pa ring mga recommendations to continue masking, especially kung maharap tayo sa mga pasyente, para makasiguro tayo na kung meron mang residual ay hindi pa rin tayo nakakapag-transmit. No? And these are all being done balancing the needs or the new information coming from science, as well as the need to provide care for our hospital patients. Yun lang.
At siguro dadagdag ko lang dun sa sinabi ni Dr. Ana is that hindi naman po ito automatic yung protocols na to. Meron pong discretion ang hospital infection control na siyang sumusuri ng risk. Hindi naman nila papapasukin yan kung sa tingin nila na sobrang infectious talaga or makakasama. Ang iba naman na ginagawa nila is to further decrease the risk. The people with shortened quarantines are the ones that will be in the COVID wards kasi may COVID na rin yung mga patients doon, in the sense na kahit may break in protocols, hindi naman mahahawa yung tao na may COVID na po. So again, it's not an ideal situation. That's why they're called contingency or crisis modes. And as much as possible, we would not want to invoke that. But if critical na po talaga na mas delikado na walang tao sa wards, this is the time that the hospital infection control can invoke this as a last resort. Pero marami rin pong ibang ginagawa, nag-augment po ang DOH, nag-augment po yung hospital ng personnel para habang sa kakayanin naman, baka hindi naman kailangan gawin ito, but when it is done under the supervision of the infection control committee of the hospital po.
I'll just like to add and inform everybody na pinag-usapan na po with our experts yung alignment nitong polisiya na to with the general public. So hindi lamang po talaga healthcare workers na nagsho-shorten tayo ng isolation and quarantine for this policy shift, pati general public. Dahil nga po katulad ng sabi namin, may science and evidence to support this. Over to you, Jas.
Thank you so much, Yusek, Doc Ana, and Doc Edsel for the clarification regarding the concern on the shortened quarantine and isolation for our healthcare workers. For the next question po, Yusek, this is still from Caroline Bongkin, CNN Philippines. The question po ay, how many health workers have been infected by COVID this January alone? And how does this number compare with the previous na ang humihingi ng nurse augmentation po from Department of Health?
Yes, just nag-gaps ka, no? I'll just answer first the first question as to the reported healthcare worker infections. No, so currently po ang ating mga ospital at mga laboratorio are having increasing number of healthcare workers infections. Sa ating laboratories, we are implementing a maximum number already of swabbing per days to ensure continued operations and of course to protect the healthcare workers at the same time. Nakikita po natin ang pagtaas talaga, sharp increase in the number of reported cases in COVID-19 among our healthcare workers this month compared to December. Kasi noong December, napakababa po ng ating datos for our healthcare workers at ngayon po talaga ay tumaas ng husto. But mostly what we can tell you, halos lahat naman po ay banayad ang simptomas or mild or asymptomatic cases. Yun naman po ang ating pinagpapasalamat ngayon, although of course it still affects our health system's capacity. As to augmentation, nakapag-deploy na po ngayong araw na ito, no? Ang ating mga uniformed personnel were deployed in different hospitals in Metro Manila. We had some deployed in Quirino Memorial Medical Center at yung iba po na deploy sa iba pang ospital natin sa Metro Manila. So augmentation are coming in. Andyan na po yung tulong ng iba't ibang mga ahensya sa ating mga ospital.
Thank you so much, Yusek. Sorry po, nagkaroon lang ng problem sa connection po. Moving forward po, let's go now to the next question po from Kathleen Forbes from Radyo Pilipinas po. The question po, Yusek, ay Representative Elpidio Barsaga Jr. po is calling for the government's pandemic response task force to consider giving additional 2 doses of COVID are already administering of protection. Is this something that our health experts are studying? Is there any truth that as well in studies that 2 doses of a vaccine with lower efficacy followed by a booster did not generate enough immunity against COVID-19? Yusek?
Yes, no. So currently, alam natin lahat no na ang naipapatupad natin lagi sa ating bansa para sa ating mga pagbabakuna, kailangan may emergency use authority. Sa ngayon po, walang applications from any manufacturers about third shots or fourth shots for boosters. No? Tayo po ay meron lang para dun sa ating additional dose or 1 dose of booster shots. Kailangan din po natin na maiulit no, sa ating mga kababayan ng current prioritization natin for all vaccination sites. We are still prioritizing the primary series o yung pong pagbabakuna sa mga taong wala pang bakuna, pagbabakuna dun sa mga taong 1 dose pa lang po ang nare-receive, pagbabakuna po at pagkukumpleto ng bakuna para sa ating A1, A2, and A3 individuals, lalong-lalo na ngayon na may threat po tayo ng pagtaas ng kaso. Napaka-importante that we focus no and we prioritize our vulnerable population. Ibibigay ko po sa ating mga eksperto, baka po sila po ay makapagbigay ng karagdagang kaalaman sa mga studies na sinasagawa ngayon or experiences of other countries regarding these additional booster doses for the population. Dr. Edsel?
Yes, thank you, Yusek. Right now, ang nag-experiment with the 4th dose is actually Israel, and everybody's watching that experience. But again, we're still using the same vaccines. Hindi pa ito yung na-tweak for Omicron, which a lot of the manufacturers are actually starting to study already. Sa ngayon, ang meron lang po tayong datos na safe and effective is an additional dose as a booster, and meron po tayong mga guidelines for that. And right now, there is evidence based on studies in the UK where they compared yung Delta at yung Omicron. Yung sa Delta, the vaccines, even without a booster, continue to prevent hospitalization at a high rate, mga 80%. Walang booster yan. But for Omicron, it goes down to about 65%. Pero if you give a booster, Omicron goes back up to about 81%. Yung sa Delta, it goes to about 83%. So, konti lang yung increase ng pag-boost for Delta. Mas mataas ng konti dun for Omicron. And so that's why the DOH went ahead and approved the 3-month boosters kasi alam naman natin na parating na rin yung Omicron. And that turns out to be a good decision in that sense because it will give added protection, especially to our healthcare workers and to our seniors and those with comorbids who are still prioritized to get these boosters.
Dr. Ana?
I just wanted to add, meron din kasing currently na may grupo talaga ng mga pasyente na maaaring tumanggap ng ika-4 na dose. Ito yung mga sinasabi nating immunocompromised. Kasi base dun sa mga datos na napag-aralan na, para sa ganitong grupo ng pasyente, ang primary dose maaring hindi lang 2 kung hindi dapat 3. So kung 3 ang kailangan nila, kailangan pa nila ng booster, so 4 talaga yung matatanggap nila. But this is a very small and very specialized population. At ito rin ay under guidance ng kanilang mga clinicians at saka ng infectious disease specialists. Yung mga pinag-aaralan sa Israel na ika-4 na dosis, kabilang din doon yung mga tinatawag na immunocompromised. So in this category, na to start with, hindi talaga maganda yung kanilang response sa just a 2-dose series. So it's a very special group. And we really need to watch this closely para makita kung may pakinabang for the general population.
Thank you so much, Yusek, Doc Ana, and Doc Edsel again for the clarification regarding the booster shots po. For the next question, Yusek, this is from Aiko Miguel, UNTV po. Are there any other COVID variants that the DOH has been monitoring aside from the IHU variant? Do we have further information regarding the Delta Cron or the Demicron?
Yes, Aiko, gusto lang kong ipahatid sa inyong lahat. Ang Department of Health naman through our biosurveillance efforts are monitoring any type of variant that may come in the country, no? Kaya po tayo nagkakaroon ng mga purposive sampling. We're not just focusing on the existing variants of concern or under investigation, pero kung meron ho tayo matagpuan na ibang variant na susumitin natin at kung idideklara ng WHO na ito ay under investigation or of concern, na monitor po natin yan. Pangalawa po, gusto ko lang hong klaruhin na ang WHO lang po ang nagbibigay ng classification kung ang isang variant na nadiskubre ay under investigation or of concern, no? So ito pong mga lumalabas ngayon, yung IHU, yung Delta Cron, Delmicron, and the others, wala pa hong binibigay na classification o additional evidence ang ating mga eksperto at WHO regarding that matter. Ito pong ating mga sinasabing Delmicron or Delta Cron hanggang sa ngayon, wala pa ho tayong nadidiskubre na ganitong lineage o ganitong variant sa Pilipinas. I'll turn it over to Dr. Edsel who can further explain all of these variants that are being discovered in other countries. Dr. Edsel.
Yes, thank you, Yusek. Yung IHU kasi, it's actually named after a French institute na nag-describe nito. Yung parent lineage nito, yung B.1.640, ay isang variant under monitoring ng WHO. So hindi siya variant of concern, hindi siya variant of interest, lower tier po siya. And they've been looking at this since November. Mukhang wala naman siya masyadong pinapakitang problema. So in that sense, they're monitoring it, but no, this is not a variant of concern. This is not even a variant of interest. Now, itong Delmicron, medyo controversial kasi ang sabi ng isang taga-WHO, mukhang contaminated yung sequencing na ginawa dun sa Cyprus na contaminate ng Omicron yung sinisequence nila na Delta. Kaya nung inanalyze nila, nung mga scientists, and again, this is a contentious issue, nakita nila na very clear na parang nakasplice siya because that does happen minsan pag nagsisequence ka kasi napakaselan ng mga processes na to eh. So there are some reports na this might be due to a lab error, and so they are checking, they are making sure na tunay po talaga ito. Kaya yung mga ganitong klaseng lumalabas kasi, kailangan talaga natin i-check and i-double check because it really causes undue panic. And when in fact, it could be a lab error or it could be something that's already being looked at. Pero medyo naha-hype lang, nagpapanik yung mga tao, nag-share. So ang important po dito, check, and always just listen to reputable sources of information. Thank you po.
Thank you so much, Yusek and Doc Edsel po for the clarification regarding the COVID-19 variants, IHU, Delmicron, and Delta Cron. For the next question po, Yusek, this is from Jenny Ravelo. What's the reason po for the lack of FDA-approved rapid tests for use by the general public? Is it because no company has applied for the FDA approval or none has passed the regulatory approval?
Yes, no. So let's be clear on that. There are approved rapid antigen test kits that are already being used by the community, but this has to be guided by our healthcare workers kapag ginagamit po nila yan. Ngayon, meron po yung tinatawag na self-administered test kits. Yan po yung wala pang aprobado dito po sa ating bansa. Wala pa ho siyang registration from FDA. But of late, FDA has already reported meron na pong 2 suppliers or manufacturers that has applied for the CPR of these self-administered test kits. Pinapa-expedite na po yan para magamit po ng ating komunidad o ng ating mga kababayan sa kanilang mga bahay. Pero kailangan maging maingat din po tayo sa paggamit ng mga ganitong klaseng test kits because it can lead to misuse and misinterpretation. Meron pong technical na proseso para magkolekta ng specimens pag ginagamit po natin ito sa bahay, at kailangan maintindihan maigi ng ating mga kababayan so that they can get accurate results from these self-administered test kits. So kaya wala pa ho sa merkado ng Pilipinas ito dahil kakasumiti pa lang po ng manufacturers ng kanilang application for FDA to register their product. Hindi po dahil hindi kasi sila nakapasa doon sa regulatory clearance na atin pong pinoproseso. So antayin lang po nating lumabas so that our community also can be able to use this in the community. But just to warn, this still has to be used at the appropriate time. Appropriate use pa rin po ang atin pong inaabiso sa ating mga kababayan.
Thank you so much, Yusek. For the next question po regarding from Camille Elemia from New York Times po. Yusek, the question po ay, the fact that Omicron doesn't appear to be as severe as Delta, will the government be less strict on COVID policies moving forward? How do you plan to treat the Omicron variant? Yusek?
Yes, we know that Omicron variant has that characteristic of having milder symptoms compared to Delta variant. But it doesn't mean that we will not be closely monitoring our healthcare systems anymore because it has milder features or milder symptoms. The more transmissible it is, the more that it affects our healthcare system as well. And we are seeing that right now with the affectation among our healthcare workers. That is one. Second, of course, when we have this kind of transmission in the community, like what we are having right now in the National Capital Region, our policy tends to shift. For example, for the interventions that we usually practice in the community in the past, right now, number one, contact tracing is not that much prioritized anymore because we know that in each household, the possibility or the likelihood that there is one positive individual is very high. So the contact tracing is not that valued or not that prioritized anymore in this kind of situations. We have this 4-door policy where we are now onto the door 2 already. We've passed the door 1. So for the incoming travelers also, we know that we have delayed the entry of this Omicron variant. And now we are now focusing on community interventions already so that we can stop the spread of the transmission in the community. So we are now on doors 2, 3, and 4 already. And third, the value of testing in our interventions. Now that we have a very high transmission rate and infection rate in the community, the value of testing right now is really for clinical management of our patients. Our testing before, what we are doing before to detect who are positive so that we can immediately isolate and quarantine becomes of second nature right now because we like to prioritize our A1, A2, and A3. These are the vulnerable sectors in our population for clinical management. Now, for community interventions, the most important right now would be isolation. So that is our policy shift right now. There are discussions of shortening quarantine and shortening isolation for the general public and the healthcare workers, of course, adopting science and evidence adopted by other countries. And of course, the last one would be ramping up vaccination because it has been proven, especially here in the National Capital Region, that vaccination has protected most of our citizens from severe infections, hospitalizations, and deaths. I'll pass it on to our 3 experts here in the call. We have Dr. Edsel, Dr. Raana, and Dr. John Wong to provide their additional inputs. We can start with Dr. Edsel and then Dr. Raana, and then we'll have Dr. John Wong. Dr. Edsel.
Yeah, I think important yung distinction na yun. We're not calling Omicron mild. It's milder than Delta. It is about 3 times, Delta is 3 times more likely to land you in the hospital compared to Omicron. But, Omicron can still land you in the hospital, which is a very important distinction. The nature of Omicron is also that the incubation period is faster than yung sa Delta. Before, it used to take about 5 days to develop symptoms. For Omicron, it's about 3 days. And if you consider that people are already contagious 1 to 2 days before they are symptomatic. For Omicron, you're almost contagious just a little over 24 hours. So it's very, very difficult to contain something like that because you've only been exposed 24 hours and then you're already passing the virus. And so the paradigm shift has to happen in the sense that isolation is very, very important because by the time you develop symptoms, you're already very, very contagious. And if you go out and get a test and there's a lack of tests or mahaba yung pila, you can actually infect other people. So there has to be that kind of balance. And again, with high vaccination rates, for people who are not in the high risk population, there is not anything that will change in terms of the clinical management. It's really all just supportive. But for people who are elderly, who have comorbids, it is important to get a diagnosis because even for those with mild symptoms, we can offer them medications, antivirals that can further decrease their risk of hospitalization by up to 90%. And so we have to prioritize those groups who will benefit. But for the vast population that is not at high risk and are already vaccinated, the risk of dying is very, very low. So the more important action point is really to isolate so that we can slow down the spread of the disease and minimize the societal impact.
Dr. Ann.
Yeah, I'd like to concur with what Dr. Edsel said. No, I think it's very important to realize that when we talk about COVID, we're not just talking about its impact on individuals. Hindi natin minamaliit yung nararamdaman ng individual patients, lalo na nung panahon na matindi talaga yung sintomas na nangyayari kung nahawaan ng iba pang VOCs ng COVID. Pero dito, kahit sabihin na lang natin na karamihan ng mga nagkakasakit ang iniinda is lagnat, ubo, sipon, dahil ang bilis ng kanyang pagkalat at maraming essential sectors ang apektado, kasama na dito ang ating healthcare workers, yung sinasabi nating mild na sakit, nagtatranslate siya into significant impact in terms of function ng mga essential sectors ng ating society. So tulad na lang siguro sa example ng mga ospital where marami na sa mga wards at iba't ibang serbisyo ng ospital ay hindi maipagpatuloy dahil ang healthcare workers ay hindi na makapasok sa trabaho dahil sila mismo ay may sakit. No? So I think the message here is we are blessed that these are relatively less severe symptoms, but it doesn't mean that we should just take them for granted kasi nga ang impact ng mga less severe symptoms na yon ay function of vital services. Thank you.
Dr. John.
Thank you, Yusek. Yeah, so infectious diseases have three dangers, no? First is transmission, no? You're not the only person affected, no? Others can be infected because of you, no? So, and we know that Omicron is 4 times more transmissible than Delta and 8 times more transmissible than the original variant, no? So that alone, no, is a risk and should not be minimized, no? Second, infectious diseases can cause severe disease, no? People may have misunderstood the studies coming from other countries, no? What they actually said was it's milder than Delta, no? They didn't say that it was a mild disease, no? And we know that Delta is already a variant that causes severe disease, no? So saying that it's milder than Delta is not saying very much, no, about how severe it is, no? And then third, variants can cause immune escape, no? So our vaccines may not work as well, no? However, just because Omicron looks like other variants, no, we cannot be assured that it can cause or generate immunity against other variants. No, kasi Omicron is a virus. No, it's not a vaccine. No, vaccines. No, we can adjust the dose. No, with an infection like Omicron, if you receive too little of the virus, no, you don't generate any immunity at all. No? If you get too large a dose of the virus, no, you end up in the hospital. No? So we shouldn't belittle the impact of Omicron on the country. Thank you.
Thank you so much, Yusek, Doc Edsel, Doc Anna, and Dr. John Wong for the answers po regarding the question po of Camille. For the next question po, Yusek, this is again from Camille po. The question po ay, what is the recent data on hospitalization? Are most of the hospitalized unvaccinated? What are the hospitalization rates for the vaccinated and previously infected individuals? And what are the patient's profile? Are they younger or older? Similar questions din po from Camille again. What conclusions can you draw from the Omicron from what the government and doctors are seeing now? And from Lay Alvis po regarding kumusta ang estado ng mga hospital sa gitna ng pagkakasakit po ng maraming healthcare workers. Yusek?
Yes, no. So despite case increases, the national healthcare utilization remains to be at low risk utilization. We have 40% for our ward beds, while for ICU utilization, it's at 38%. Although in some of the regions like the NCR, yun pong utilization natin for ward beds is nearing yung moderate natin na threshold. But still, hindi pa ho yan nakakabahala, no, compared when we were having the Delta experience. So sa ngayon po, base sa aming datos ng Department of Health, we found, no, that based on our hospital data, 85%, no, almost 85% of those admitted are not vaccinated, and almost 93% of those who died from COVID-19 ay hindi po bakunado o kaya ay partially vaccinated lang. This is as of December 28 data po. We are still trying to finalize our most recent data, but still the trends look the same. I will call on Dr. John because he has studied some, no, of this hospitalization data that we have right now comparing to the Delta experience that we had before. Dr. John, if you can add on to our answer, please.
Thank you, Yusek. So what we've seen in NCR now is that compared to during the Delta surge, no, we have 24% less hospitalizations, and compared to non-NCR regions, no, we have about 60% no less hospitalizations. No? And the difference is that compared to back in July, September, no, during the Delta surge, no, and compared to non-NCR regions, no, the NCR has a much higher vaccination rate, no. I think 75% now compared to 15% last September, or last July, no, and yes, 75% now compared to 35% no in non-NCR regions. No, so on both accounts, no, vaccination is protecting the NCR from high hospitalization rates. No, so we need to do the same thing, no, for other regions. No, before the surge arrives there, no, vaccinate them to a higher level of protection, no, especially for the elderly, because the elderly make up 80% no, of all hospitalizations. Thank you.
Thank you so much, Yusek and Doc John Wong. For our next question po from Camille pa din po, we have the question po ay, what is the DOH definition of mild cases? Yusek?
Yes, we have definitions adopted from the WHO definition of cases. No, so it was issued out from our department memorandum 2020-0381, which is the interim guidelines on COVID-19 disease severity classification and management, wherein it is stated that mild cases are defined as symptomatic patients presenting with fever, cough, fatigue, anorexia, myalgias, other non-specific symptoms such as sore throat, nasal congestion, headache, diarrhea, nausea and vomiting, loss of smell or loss of taste preceding the onset of respiratory symptoms, and what is important, they have no signs of pneumonia or hypoxia. So ito po yung ating ginagamit na definition ng mild symptoms. Hindi kailangang sama-sama lahat ng simptomas na yan para masabi nating sila ay mild case. Maaring sipon lang, maaring lagnat lang, maaring kaunting ubo lang, maaring masasakit lang ang kasukasuan, no? At makaklasify na rin po na mild symptoms sila. Pinapaalalahanan po natin lahat ng ating mga kababayan na nakaka-experience ng mild symptoms or banayad na simptomas, please immediately isolate para po maputol natin ang transmission ng sakit na ito sa ating komunidad.
Maraming salamat po, Yusek, for explaining the definition of the mild cases and for the reminders po sa ating pong public. For the next question po, Yusek, from Red Mendoza ng The Manila Times. The question po ay, sa dami po ng kaso ng COVID-19 ngayon sa Pilipinas, does the DOH look at the possibility that there could be a breakdown in testing that could make it impossible to see the trend if it's going up or down, and could lead to a possibility na hindi na makontrol ng Pilipinas ang pandemyang ito?
Yes, Red, no? So unang-una, hindi po tayo reliant sa testing alone para makontrol natin o ma-prevent natin ang mga pagtaas ng kaso sa ating bansa. Yes, testing is very important, no? Especially when we report cases para guided po ang ating mga plano, guided po ang ating interventions. Pero ngayon, katulad ng sabi natin, dahil sa napakataas na transmission ng sakit sa ating mga komunidad, yun pong testing, meron po tayong shift into our policies, kung saan tinitignan po natin na mas importante na po siya ngayon for managing clinically our patients, especially the most vulnerable. Yun pong dating ginagawa natin na pagtetest para ma-determine natin kung sino ang may sakit at wala so that we can isolate and quarantine. Ngayon po na napakataas ng infection rate sa community, hindi po masyado natin na binibigyan ng ganyang priority. Ang priority natin ngayon, matest po natin lahat ng vulnerable para mabigyan ng karampatang lunas. So yun pong sinasabi na kung mag-breakdown ang testing ay hindi na makokontrol ang pandemya, ay sa tingin ko po ay hindi naman po siya parang directly linked at hindi po magkakaroon ng pag-breakdown ng ating mga sistema dahil tayo po ay na-overwhelm sa pagtetest. And actually, hindi naman po papayagan din ng gobyerno na hindi po na magkaroon ng ganitong klaseng sitwasyon kung saan magbe-breakdown ng testing natin. Kaya nga po tayo ay nagpapatupad ng mga prioritization, nagre-redirect at nagre-refocus tayo ng ating mga polisiya para po maiayos po natin ang ating resources kung saan po talagang mas importante nating gamitin. I will call on our experts again to give supplemental response to this response. I'll call on Dr. Edsel, Dr. Ana, and then Dr. Wong. Dr. Edsel?
Yes, thank you, Yusek. Actually, this is something that a lot of countries are already shifting to. Yung sa Israel, ang pini-PCR na lang nila actually 60 years old and above kasi yun nga yung pwedeng bigyan ng mga antivirals. Below 60, either ina-antigen na lang nila or in some cases, kung kulang ng antigen, isolation is the key. This is the same situation that's happening in Ontario and in Canada. Kasi ang nangyayari rin is, kung i-overload mo yung iyong RT-PCR, tumatagal yung turnaround time. So kung it takes 3, 4, 5 days, yung gamot para sa 60 years old and above, kailangan mo ibigay within 5 days of onset of symptoms. So kung ma-delay yung PCR mo ng napakatagal, hindi mo na mabibigay yung gamot na yon. So nagkakaroon ng prioritization shift, lalong-lalo na dahil alam natin kung mataas na talaga ang level ng pagbabakuna, the risk of dying from COVID if you are not part of the vulnerable population is no higher than the flu. But of course, if you're not vaccinated or you're in the vulnerable population, mas mataas yun kesa sa flu. So we have to prioritize those that can benefit from treatment. And this is, again, a policy shift, understanding na ang game changer talaga dito yung pagbabakuna natin ng maraming tao dahil mas tina-target na natin yung ating interventions dahil yung ibang nabakunahan na hindi naman vulnerable, mukhang magiging okay naman sila.
Thank you so much, Doc Edsel and Yusek for the answers po. Let's go now to the questions from Lay Alvis po, Yusek. The first question po ay, may nakikita na bang pagbagal sa pagdami ng kaso?
Yes, Jazz, no? So, unang-una, yung ating si Dr. Wong ang tatawagin ko para dito, no? Para sumagot. But based from what we are looking at right now, hindi sa pagdami, Lay, ang nakikita natin. Ano? Nakikita natin yung doubling time, medyo tumaas, no? And Dr. Wong maybe can further explain this. Dati po kasi it's 2.2 days. Ito pong nakaraang araw, nakita natin yung doubling time ay medyo humaba ng 3 to 4 days. Pero yung sa pagdami, madami pa rin po. Tuloy-tuloy pa rin ang pagtaas. Positivity rate is high also. So hindi pa ho natin nakikita yung pagbaba ng kaso o kaya ay pagbagal ng kaso. I'll turn it over to Dr. John to further explain. Dr. John.
Thank you, Yusek. Yeah, so what we've seen since the start of this current holiday surge is a doubling time of 2 days. No? So this is sort of a signature, no, of Omicron. No? Coupled with that, no, we also have lower hospitalization rates in NCR. No? But having said that, no, we really need other evidence to say that this is Omicron. No? I'm not just saying that this is Omicron. Regarding the trend of future cases, no, I think rather than trying to predict how many more cases we will have in the coming days, no, we have to encourage the public to observe, no, in minimum public health standards, no, kasi it's the cases will not change on their own, no. Just because we have a lot of cases now and it's growing, it doesn't mean that it will continue to grow, no. We have to change our behavior, no, observe the public health standards, no, in order to reduce the transmission and therefore the number of cases, no. So the increase and decrease of the number of cases in the future is dependent on the public's behavior also. Thank you.
Thank you so much, Doc John Wong and Yusek for the answer po. For the last question of Lay Alvis po, Yusek, the question po ay, na-establish na po ba, Yusek, ang local or community transmission ng Omicron variant?
Lay, alam mo, pag pinag-usapan officially established ay hindi pa po. Dahil we need our whole genome sequencing, yung ebidensya po nito para masabi natin talaga yung transmission na level ng Omicron dito sa ating mga communities. But with what's happening and with what Dr. Wong has just mentioned, no, yung trend po ng mga kaso, kung paano nagdodoble ang mga kaso, kung ano po yung mga na-experience ng mga simptomas ng mga tao, yun pong likelihood na andito na ang Omicron sa ating mga komunidad ay very high. Kaya po katulad ng lagi namin sinasabi, we have assumed already from the start that Omicron has entered our communities. Kaya po yung ating mga interventions, doon na po directed talaga that Omicron is in our communities and affecting our population. Ngayon gusto ko lang pong i-reiterate uli yung sinabi ni Dr. Wong na instead of us focusing dun sa mga numero ng kaso, hanggang saan tataas, sino mga maapektuhan, na andito na ba Omicron, wala pa ba ang Omicron, let's focus on what we can do. Let's focus on complying with the minimum public health standards. Let's stay at home. Kung wala naman po tayong gagawing importante sa labas, lagi po tayo magmamask. Lagi po natin sisiguraduhin ang pupuntahan natin ay hindi matao. Huwag muna po nating ilabas ang ating mga nakakatanda, ang ating mga kasama sa bahay na may sakit, at saka yung ating mga kabataan. Stay at home muna. And of course, most importantly, kapag nakaramdam ng simptomas, isolate already. And please have yourselves vaccinated once you are eligible. Over to you, Jess.
Thank you so much, Yusek, for the answers po. We have several questions din po that we have categorized regarding vaccination po. And I hope, Yusek po, you will be able po to give clarifications at ganun din po sa ating mga health experts po that we have right now po. There are 2 questions lang po regarding the vaccination po. Number 1 po, totoo po ba na mas mild ang tama ng COVID-19 sa mga bakunado na at boosted na? That's the first question. At saka second po, totoo po ba na ang Omicron ay magbibigay ng immunity or lunas sa mga tao laban sa COVID-19?
Sige, Just, no? So I guess our experts would be most appropriate to answer this question. So let's call on the three of them and then we'll have the next question. Dr. Edsel, you can start.
Yes, thank you, Yusek. It's very clear that whatever variant you're talking about, our vaccines work, and they work to particularly well in reducing hospitalization, severe disease, and risk of death. Dito sa Pilipinas, napakita na rin naman ng DOH since we started vaccinating, 85% of those who ended up in the hospital because of COVID are unvaccinated, and 93% of those who have died since we started vaccinating are unvaccinated as well. So, klaro naman yon. Now, in terms of yung boosting, yun nga yung katulad nung sinabi ko yung pag-aaral sa UK, mukhang mas maganda ang epekto ng boosting specifically for Omicron. Pero yung sa Delta, mukhang even just 2 doses na nanatiling mataas yung protection against severe disease. All of our vaccines work to prevent severe disease, and this is because yung vaccines natin, dalawa po ang pamamaraan na gumagana yan. Unang-una yung antibody na which is very popular, mas madaling intindihin ng mga tao, pero ang hindi masyado naiisip ng mga tao ay yung tinatawag na T cells or mga kawal ng ating katawan na hinahanap yung virus na nakatago sa mga cells ng ating katawan. So even if tinamaan na yung antibodies, hindi na ganun kataas or hindi na ganun siya nakaka-recognize nung variant ng COVID, ang ating T cells ay nananatiling matatag even beyond 6 months, even without a booster, at nakakayanan niyang mag-prevent ng severe disease. And this is what we're seeing consistently across all populations, across all vaccines. Meron lang some differences in the level, but in general, significant po yung protection ng ating vaccines against severe disease, to the point na if you're not in the high-risk population, nagmimistulang trangkaso na lang ang COVID at ang risk ng mamatay is the same as that of the flu. And hindi naman po tayo nagtetest ng lahat ng tao for the flu, hindi naman po tayo nagla-lockdown for the flu. So for those people who are not in the vulnerable population or are fully vaccinated, lalong-lalo na kung na-boost, then yung threat sa kanila ng COVID at this point is at the level of the flu.
Dr. Ana?
I just wanted to pick up on the point that Dr. Edsel mentioned regarding the impact on vaccinated. Kasi naman, from the pediatric perspective, kasi nga karamihan sa mga bata ay hindi pa bakunado, meron pa rin tayo nakikita mga pasyente na medyo matindi rin ang nararamdamang simptomas. So I guess my point is, if you're already qualified to be vaccinated, please take advantage of that protection. And that protection will not only benefit you, but all the vulnerable members of your household na hindi pa pwedeng magpabakuna dahil wala pa sila dun sa age group na sinasakop, or they belong to the elderly population na kahit bakunado na, hindi natin maasahan yung full na impact ng protection kasi may kahinaan na talaga yung kanilang immune system. So overall, no, we see that vaccinated individuals do better. We see that the unprotected, unvaccinated remain to be vulnerable. And overall, we still want to try to avoid catching this disease because even as people keep thinking na it's mild, ubusipon lang siya, ang concern natin is we really don't have enough information on long-term impact. So wala pa tayong datos para sabihin na hindi ito pagmumulan ng mga long-term na consequences like long COVID or MIS-C. And syempre maganda pa rin parati ang pag-iingat. Thank you.
Dr. John?
Thank you, Yusek. So vaccination has several goals now. First is the prevention of hospitalization and deaths. Second is the prevention of symptomatic disease. And third is the prevention of transmission. So for the first goal, prevention of hospitalization and death, vaccines continue to be very effective, whether we're talking about Alpha, Beta, Delta, or Omicron. So it's still effective versus Omicron. For symptomatic symptomatic disease and transmission, this is when this is where the protection by vaccination has decreased, and that is the reason for boosters. So vaccination and boosting are still our best public health interventions for Omicron. And we should continue to do that. But I think the emphasis should be, or the priority should be, to get the unvaccinated vaccinated, especially the elderly, because most of the people who are hospitalized now are the unvaccinated, not the unboosted. The unboosted will have mild infections. Thank you.
Thank you so much, Yusek. We will now go to the questions that have been submitted over the Zoom chat po. Let's start with Caroline Bongkin po, and this question po, Yusek, is for everyone po, for you and for the health experts po. The question po ay, there are less severe and critical cases today. Excuse me. Is this because of the high vaccination rate in NCR or because of Omicron?
Yes, Just, no? So let me start to answer, and of course our experts will give in their expert response. No? So sa atin po, pag nakita natin sa National Capital Region, ang gawin nating ehemplo. Ang National Capital Region, napakataas po ng ating vaccination rates dito po sa NCR, and we are seeing that severe and critical cases are kept to a minimum. So ibig sabihin po, yung ating pagbabakuna ay nakapagbigay ng proteksyon sa marami sa atin, no, dito sa NCR on preventing hospitalization and severe infections and even deaths. Yun pong milder symptoms ng Omicron kumpara sa Delta ay hindi po natin pwedeng ipagsawalang bahala. Katulad po ng sabi ng mga eksperto natin, even though it's mild, pag tumama po yan sa vulnerable na populasyon natin, maaari pa rin sila magkaroon ng severe infections. So kailangan lamang po talaga na maintindihan natin, the vaccines have protected us and it's showing us that it can protect us. So sana po yung ibang hindi pa nakakapagpabakuna, and of course all of those vulnerable, senior citizens, those with comorbidities, hindi pa ho nababakunahan, magpabakuna na ho tayo. So maybe our experts can further explain ito pong question ni Caroline, Dr. Edsel, Dr. Ana, and then Dr. John.
Yeah, I think we're giving Omicron too much credit eh. Ang talagang star talaga dito kung bakit mababa ang ating critical and severe is really our vaccination rate. Kahit ano pa man to, kahit Omicron to, kung mababa ang vaccination rate natin, we would still be seeing increases in critical and severe. It really is our vaccination that is saving lives. And that is why we are also concerned na pag lumipat itong Omicron na to, which we really think is what's causing this latest increase in cases sa mga provinces na mababa pa ang vaccination rate, lalo na sa A2 and A3, they will get into trouble. They will get into real trouble. So while it is fortunate na mukhang milder ang Omicron ang nagdadrive ng current wave natin, the more important protective factor here is the high vaccination rate. And that should really be our message na, like sinabi ni Yusek, kung hindi pa kayo nagpapabakuna, well, you know, it's like you're getting caught outside in the storm. Wala kayong protection. Magpabakuna na as soon as possible because it not only protects you, it protects the people around you. Yun lang po.
Dr. Ana?
Siguro yung isang point ni Dr. Edsel that I'd like to re-emphasize also. Siguro for those regions in the country where the vaccination rate still needs to catch up, habang hindi pa siguro nakakarating or we're not yet seeing the pattern of spread that's expected with Omicron, siguro dapat ito yung panahon na magdoble, triple, double or triple push for the vaccination drive to happen right now. Para sana pag makarating na, kasi mahirap sigurong masabing hindi ever makakarating ang ganong klaseng wave sa iba't ibang parte ng bansa. We want to get those areas ready as quickly as possible para hindi naman sila dagsain ng dami ng kaso tulad nung nakikita natin ngayon sa NCR.
Thank you. Dr. John?
Thank you, Yusek. The way to answer that question is to compare the hospitalizations between NCR and non-NCR regions. No? For the current vaccination rate in non-NCR regions is about 35%, and in NCR it's 75%. No? So, and we've seen throughout the whole surge that we really have 60% less hospitalizations compared to non-NCR areas. No? So vaccination is protecting NCR. No? So before the surge arrives in the other areas, no, we have to vaccinate them to a very high level. Thank you.
Thank you so much, our experts and USEC. We'll be accommodating last 3 questions na lang po. All other questions will be submitted na lang via Viber. We would like to ask the question of Giselle Ricafort, USEC. The question po ay, kinontra ng Philippine Genome Center ang statement ni Secretary Duque na dominant na ang Omicron sa bansa. Delta pa rin po ba ang nagdodominante ngayon? Similar question din po from Lay. Dominant na ba ang Omicron sa bansa?
Yes,
Yusek Rosette?
Thank you, Jas. Giselle, kung maaari, no, wag nating gamitin yung salitang kinontra. Hindi po kinontra ni Dr. Cynthia Saloma si Secretary Duque. Ito po ay ipinaliwanag lang niya kung ano po ang lumabas sa ating whole genome sequencing results. And also to clarify, nung nagbigay po ng pahayag si Secretary Duque, he was explaining about the most recent run. Dahil yung most recent run po, nakita po natin na mas madami po ang Omicron detections kumpara sa ibang mga variants na atin pong nakikita dito sa ating bansa. Sa ngayon po, ang Delta variant pa rin po ang pinakamataas na merong lineage dito sa ating bansa, comprising about 43% of detections. And ang kasunod po nito, 18% for Beta variant, 15% for Alpha variant, at para po sa Omicron, totaling 43 detections, ito po ay 0.21% pa rin. Again, let me clarify, hindi po kinontra ni Dr. Cynthia Saloma, si Secretary Duque. Ipinaliwanag lang po niya kung ano po yung naipaliwanag ni Secretary Duque na latest run po ng ating whole genome sequencing. Jas?
Maraming salamat, Yusek, for the clarification on the question po regarding PGC and Secretary Duque po. For the next question po, I would like to call on Dr. Wong and Dr. Edsel for this question po. Doc Wong and Doc Edsel, the question po is from Raul Dancel of the Straight Time po. Question po, just the department's reaction to opinions shared by Octa's Dr. David that the positivity rate is stalling and that we may see cases peaking by next week. But if cases continue to rise 40,000 to 50,000 a day, or to a level that will outpace the number of tests being done, we'll be losing visibility already, and that real scale of outbreak would not be clear anymore. Dr. John?
Thank you. So we have to understand how positivity rate is computed. No? So positivity rate can increase when 2 things happen. No? When number of cases increase, or when the number of tests decrease, no? Or both. No? As long as the number of tests are increasing, no, then the increase in positivity rate is largely coming from an increase in the number of cases. Thank you.
Thank you so much. Dr. Edsel, would you like to add some points?
Yeah, I think there's a couple of things. First of all, we have to, we can't keep testing all until, we put all our resources into testing kasi sobrang dami na nung cases. I mean, when there's a flu outbreak, na minsan hundreds of thousands, in some countries, million yung flu, they're not gonna kill themselves testing 5 million people in one day. The bottom line is, we have statistical methods to estimate kung ano yung impact ng pandemic. You don't have to test the whole population every single day to figure out kung ano yung prevalence rate, kung ilan cases, What you can do is proper sampling. So instead of testing 100,000 people, you can test 1,000 people, tingnan mo yung positivity rate. As long as well distributed yon, you can estimate kung ano yung rate sa population. And that's really where a lot of countries are going now. Kasi it's becoming less and less efficient to have to test every single sick person na alam naman natin karamihan dyan, basta bakunado, hindi sila mamamatay kasi nagmimistulang trangkaso na lang yan. So i-reserve natin yung ating tests na dapat mabilis bumalik dahil hindi naman na-overload yung RT-PCR laboratories para dun sa kung mag-positive sila, mabibigyan natin sila ng gamot, malulower natin yung risk nila na mamatay. Now, for the rest of the general population, kung mataas ang level ng COVID sa komunidad pero mataas rin ang vaccination rate, para alam lang natin ano nangyayari, doon tayo gumagawa ng tinatawag na surveillance where we will test people in a random sample, malalaman natin kung ilan yan. Marami pong methods na hindi mo kailangan i-test bawat tao na magpakita sa'yo. Dati iba yung trust kasi kino-contain natin kasi it wasn't this terrible naman na isang araw pa lang nakakahawa na ng 3-4 yung tao. Ngayon nakikita natin, ma-detect mo pa lang yung isa, yung buong bahay nahawa na. Parang inuumpog mo yung ulo mo sa dingding hindi mo matatalo yung dingding. So what you have to do is focus, and the high vaccination rates allow us to do this because alam natin na kahit hindi natin ma-pick up yung isang tao na fully vaccinated na hindi naman high risk, they will generally do okay as long as mag-isolate sila para hindi na sila maghawa ng iba. So more efficient use of the resources, understanding that we have made our society safer, especially for those people who are vaccinated and do not have high risk. For the rest, yung A1 to A3 will continue to test them and will do proper surveillance para we know what level of infection is going on in the community.
Thank you so much, Dr. Edsel. For the last question po that we can accommodate for this media forum, again, those questions that will not be accommodated for this media forum will be submitted na lang via Viber within the day po. Last question po, Dr. Edsel, and this is for you po. The question po is from Red Mendoza, Doc Edsel. May threat po ba ang sinasabing combination ng Delta and Omicron variants ng COVID-19 na na-report po sa Cyprus? How can we assuage the public against these so-called new variants?
Yeah, as I said, that particular one might actually be due to a lab error according to WHO scientists. So ayusin muna natin yung news kasi mahirap na react sa mga ganito na hindi naman verified. So let's verify na it's really a new variant and not a lab error. And then number 2 is if it is a new variant, then papanoorin po natin, we'll check on the characteristics. Meron pong methods ng WHO to figure out if something is showing characteristics of a variant under monitoring, variant of under observation, or a variant of interest or a variant of concern. And so we have parameters for this. Huwag po tayo magpanic, huwag po tayo mag-share ng fake news. Laging ifa-fact check. Actually, ang dali lang mag-fact check sa Google Hindi ko nga maintindihan kung bakit mga tao nagtatanong pa sa akin. I don't even look at the scientific articles yet agad. Ginugoogle ko lang and makikita mo that in the very, very quickly, reputable media outlets will tell you this is false, this is fake, this is misleading. It's first of all, siguro first layer para sa ating mga kababayan. When you see something na ganyan, just do a quick fact check. You can Google search it. And kung may question pa rin kayo, then of course, don't share it agad. Ask the proper authorities. Ask the DOH. Ask reputable sources of information. Kasi po, ang dami-dami talagang fake news, and it is noise, and it is really distracting, and it is killing people. So please, this is my call to our media partners. Help us crack down on all this fake news because it is distracting us from working to end this pandemic. Thank you po.
Thank you so much, Doc Edsel. Give me a second lang po. Okay. Last question po that we can accommodate This is from Joseph Morong po. The question is, the proposal to shorten quarantine period for public who are asymptomatic and vaxxed to 5 days. Is this not counterintuitive given the rise of COVID cases? Doc Edsel and Doc Ana,
You mean the shortened quarantine
may we have your
overall?
inputs regarding this?
Yeah, the CDC made those assumptions. We're not adopting what the CDC is saying right now. We are working on our own versions. But in general, the reason for these changes in tweaking quarantine and isolation, particularly for those who are fully vaccinated, is guided by the most recent scientific findings. First of all, lalong-lalo na sa Omicron, maaga siya mag-shed. Sinabi ko nga, mga just after 24 hours, nagsa-start na mag-shed yan. Pero maaga rin siya mag-stop shedding. In most cases, 3 days from the start of symptoms, pababa na yung viral load. And that's why the CDC pegged it at 5 days kasi they think 90% of people are done shedding already. So yun yung peg na pinag-aaralan namin. We're not necessarily agreeing with that, but there is a basis for doing that. So, we will look at those scientific findings. And yung sa quarantine ganun rin kasi dati, di ba, we would quarantine people for 10 days kasi we think that the symptoms will come out anywhere from 3 to 14 days with an average of 5 days. Ngayon sa Omicron, 3 araw pa lang nagkakasintomas na sila. So these are all science-guided. And, again, as Yusek Rosette has said, the government will not adopt policies that we think will be harmful. And so these are all science-based. And these are things that other countries are adopting. We will localize these depending on our own situation, but there are scientific bases for these policy shifts, and that's what that's what we're here for. That's what the technical advisory group, the all experts groups are for, because we continue to study not just what's going on here, but we also look at what other countries are doing and what the experts in the other countries are doing.
Thank you, Doc Edsel. Doc Ana, rejoinder po.
It might seem counterintuitive if we were to base the recommendation on what we knew about the way the virus behaved in the past. But as has been mentioned, we have new information, and that's what we're basing the current recommendations on. I think this also should remind people that as knowledge evolves, let's say over time makita na naman natin na mag-iba ulit ang kilos nitong virus, malamang mag-iiba din yung recommendation. So hinahabol natin dito is we use what is known, we use what is coming up, and we tailor fit our recommendations based on the latest information so that we are best, our response is tweaked towards what is happening on the ground.
Thank you so much, Doc Ana. And these are all the questions we can accommodate po. We will now proceed to our final messages. Maybe let's get 1 to 2 messages din po from our health experts we have right now. Let's start with Doc John Wong.
Thank you. So for areas that for the searches that arrive, get vaccinated. For the NCR, and maybe 3 and 4A, regions 3 and 4A, where the surge is already here. Once you have symptoms that resemble COVID, isolate right away. Don't wait to get tested. I mean, go and get tested pa rin, pero before you do that, isolate, so that you can protect the rest of your household. Remember that Omicron is so fast na by the time you schedule an appointment for testing, it might have spread already to your household. So once you feel something, isolate yourself. Thank you.
Thank you so much, Doc John Wong. We go now to Doc Ana Ong Lim.
I'd like to echo what Dr. Wong mentioned, no? Paradigm shift talaga to kasi nung nagsimula yung yung Omicron tuloy yung COVID, 'di ba? Ang nasa isip natin parate, oy kung magkasakit magpapatest. Ngayon, ang dapat na papasok sa isip natin pagka nagsimulang magkaroon ng simptomas, however mild it is, dapat ang response should be isolate. Kasi dahil napakabilis nung napakaiksi nung serial interval ng infections, sa loob lamang ng mga 2 araw or so magkakaroon na ulit ng panibagong may sakit sa loob ng isang cluster. Wala nang masyadong time para magdalawang isip pa at pakiramdaman yung nararamdaman natin to decide whether this is COVID or not. So the initial response is if you feel something, please isolate. And then if you can access testing, then that would be good. If not, then your healthcare professional can tell you whether your symptoms are consistent with COVID, and this can be correlated with your exposure history. And from there, pwedeng madesisyonan kung ang management mo ay tutungo dun sa direksyon ng pag-manage ng COVID or kailangan pa ng ibang klaseng testing para malaman kung ano kaya yung itong mga simptomas na iyong nararamdaman. Thank you.
Thank you so much, Doc Ana. Doc Edsel po.
Yeah, I think ito naman talaga yung reason kung bakit tayo nagbabakuna. We were trying to vaccinate as many people as possible in as short a time as possible in anticipation of future outbreaks of coronavirus. And nandito na nga tayo. We have a more transmissible variant, maybe a little milder than Delta, but our vaccines are doing the job. They are protecting us from severe disease, especially those who are not in the vulnerable population. So we have to trust the vaccines to protect us, and we have to continue to vaccinate as many people as possible. And we have to focus our efforts to those people who remain vulnerable, and of course the unvaccinated, kung pabakuna na sila or kung magkasakit sila, at least may mabibigyan tayo na gamot. The very important thing is hindi po ito 2020. Yung iba nga sinasabi nila is 2022. No, it's not. 2022 is very different from 2020. Ang dami nang nabakunahan, marami na tayong gamot to save people even if makalusot sila yung COVID sa vaccine, even if they're not vaccinated, although mas malaki pa rin yung tama and chance of dying. So we are not helpless. We have the tools to manage and thrive and live through this pandemic. So let's trust the vaccines. Let's slow down the spread so hindi nagkakasakit ang healthcare workers natin by wearing our masks, our minimum public health standards, but trust the vaccines. They will help us end the pandemic. Thank you po.
Thank you so much, Doc Edsel. For our closing message po, we have Yusek Rosette Singh-Vergere. Yusek?
Yes, thank you, Jazz, at maraming salamat po sa ating mga eksperto na dumalo po ngayong araw sa ating media forum, Dr. Edsel Salvania, Dr. Ana Ong Lim, and Dr. John Wong. Bagamat nasa ikalawang linggo pa lamang po tayo ng Enero, malaking hamon na po agad ang ating hinaharap, ito pong Omicron. Gayunpaman, punong-puno po ng pag-asa ang kagawaran ng kalusugan na sa lalong madaling panahon ay makokontrol at mapagtatagumpayan din po natin ang laban, hindi lamang po dito sa Omicron, kung hindi pati na rin po sa ibang variants ng COVID-19. Kung kinaya po natin noon ang naging hamon ng Delta variant, kakayanin po natin uli ang banta ng Omicron. Sinisiguro po ng kagawaran ng kalusugan na kung gagawin po natin ang sama-sama ang mga ginagawa po natin noon, ang mahigpit na pagsunod sa minimum public health standards, ang pagiging maagap sa pag-isolate at pagka-quarantine kung sakasakaling mayroon na tayong simptomas, in no time, kakayanin po nating lahat ito. Maliban po sa aking mga nabanggit, kaagad po tayong magpa-test, right test at the right time para kaagad nating matukoy ang mga hakbang na kailangan nating gawin. Kung mild lang po ang ating simptomas, sulitin po natin ang ating mga telemedicine services upang maiwasan po natin ang pagkapuno ng ating mga ospital. Higit sa lahat, magpabakuna na po tayo. Ito po ang ating unang pangdepensa laban sa virus, mapa Delta man, mapa Omicron, o yung pong mga naunang variants of concern. Ang mga bakuna po na meron tayo ngayon ay garantisadong ligtas, epektibo at higit sa lahat, libre pong binibigay ng ating gobyerno. Atin pong pairali ng ating disiplina at malasakit sa isa't isa sa pagsunod po sa ating mga safety protocols. At lagi po natin tatandaan na huwag po tayo agad-agad maniniwala sa mga impormasyon na mali na kumakalat. Lagi pong ugaliin to verify information that we get so that we get accurate and truthful information. Muli po, amin pong pinapaalalahanan ng lahat, sumunod po tayo sa ating mga safety protocols. Huwag na muna pong lumabas kung hindi naman po kailangan lumabas para po tayo ay maging ligtas laban sa COVID-19. Maraming salamat po at mag-ingat po tayong lahat.
Thank you so much, Yusek, and thank you so much to all our media partners. Good afternoon, everyone.